Early detection of skin cancer is important because it could save lives. It could potentially mean the difference between life and death for somebody. So most skin cancers could be treated very easily with an in-office procedure, whereas advanced skin cancer could potentially be deadly. A self-skin exam is what we recommend for patients to be able to look at their skin and evaluate their skin, typically on a monthly basis. And the things that we would like for them to look at is early detection of melanoma is the main one, given the fact that detecting it early could make a significant difference in how well a patient does. We talk about the ABCDEs of melanoma just as kind of a mnemonic for patients to be able to remember what they should be looking for. So the A stands for asymmetry. And basically, a normal mole tends to be symmetric. So if you cut it down the middle, the two halves would look like one another. Whereas if it's asymmetric, one part could start to change shape, or the color could become uneven throughout the mole or the growth. So the B stands for border. So a normal mole has a well-defined border where you could really see where the mole ends and where the normal skin begins. When that's obscured and the border becomes hazy or fuzzy or not well circumscribed, the distinction between the mole and the normal skin around it, that could be a concerning sign. It could indicate that the mole or the growth or the cancer is potentially growing on the edges. It needs to be evaluated further and potentially biopsied. The C stands for color. So a normal mole has an even symmetric color, whereas a abnormal mole or a melanoma could have variegation in color, meaning there are different shades of brown. It could have some black in it. It could have even red or blue or gray or white. If there's different shades of color or uneven color, it should be evaluated. The D stands for diameter, and if a mole or a growth on the skin is larger than 6 millimeters, which is about equivalent to the size of a pencil eraser, it could be potentially growing. It might be a melanoma and needs to be evaluated. And lastly is E. E stands for evolving, which essentially means that it's changing. So a normal mole should stay pretty even. The exception to that is in children, because children develop new moles and they could change and mature and grow in size. But in adults, a mole should not grow or change. And so if there's any changes to it, which can sometimes be difficult to monitor, but that's why we recommend the monthly skin exam, because you kind of get used to looking at your moles on a regular basis. Generally recommend a screening full skin exam for almost everybody at least once a year, but certainly if you notice any changes to your moles or any of the ABCDE symptoms, then you should see a dermatologist and obtain a full body skin exam.